Asthma is a respiratory illness which is characterized by difficulty breathing with wheezing and coughing. It is often treated with the use of an inhaler. The inhaler must be used correctly in order to properly deliver the medication to the lungs and to reduce adverse side effects. The use of an aero chamber is highly recommended. Rosario Holmes, asthma educator for the Lung Association, explains how to properly use an inhaler.
This is the more common inhaler that you can see in the market, and mostly the people, this is the one that they have, okay? So we are going to see how we use this together with the aero chamber. The first thing that we have to do is to take the caps from this. Very, very important, because many people forget and they are going to put it together. So the medication never will be delivered, okay? So we caps from that, and we take this cap here. All the time that you are taking this medication, you have to be sitting down or standing up. Never laying down, okay? Number one, shake it really well. It has to be shaken to be sure that the medication inside is completely mixed, and then to build up the pressure. So more pressure than we have, the particles that they are coming out, they are going to be very tiny. And those ones are the only ones that they are going to go to your lungs. The big ones, they are going to drop here in the aero chamber or in the mouth. That is no good. So this is important, that you shake it really, really well, okay? So we put it together here. And before taking, we have to empty the lungs. So to empty the lungs, you have to blow slowly out. Now, blow until you feel that you're still having some air in your lungs, but don't wait until the end, because you are going to be gasping. And like that, you don't have enough time, to take the medication. So you start to blow up, and then in the middle, when you hear, that you feel that still some air, you are going to put the aero chamber in your mouth. You press one puff, and then you take it slowly and deep, like that. And then we hold it for 10 seconds. Okay, now I'm going to do it. So number one, take the caps, shake it, put it together, and then blow. And that's only one puff. If you need to take a second one, we have to wait at least 1 minute or two. And then you start again from the beginning, shaking the inhaler, put it together, and then to empty your lungs, put the aero chamber in your mouth, release one puff, and then to take it slowly again.
Be sure to inhale slowly and deeply.
So when we are using the aero chamber, one step that we have to be very careful is how we are taking the single breath, because if we go too fast, there are a little alarm that is going to sound. So when you hear that, means it's run, it's too fast. And then again, the medication goes too fast in the back of the mouth. So we have to do it slowly and deep, okay? Otherwise, you are going to hear this. That means run.
Types of aero chambers.
So we have three kinds of aero chambers. This one is for the little ones from the newborns to 6 months old. This one is from 6 months to 6 years old. And then the blue one for the adult from 7 years old to 99 years old. This is the three aero chambers. Now we have two. This one, the adult one with a special mask, is for the elderly person that they cannot take a one single breath, so they can breathe in and out like the kids do.
The importance of using an aero chamber.
Many people, they are using the inhaler without the aero chamber. The way that they do is to shake it very well, again, but they put it inside the mouth. Now, the distance between the lips and the back of the mouth is almost this much, okay? So, if I'm going to do this, what happens, the medication is going to go too fast. So everything is going to be hitting the back of the mouth, and then the medication is going to be there. The person is going to swallow, and the medication go to the stomach. And in that way, that person can be having too many side effects with the medication doesn't go to the lungs, where is the place that it's supposed to be.
Use of an inhaler without an aero chamber.
If the person needs to use the inhaler but doesn't have the aero chamber for any reason, another way to do it is at least 4 fingers from the mouth. So you have to check the medication very well, and then you measure at least 4 fingers, so it will be almost here. Now to put your head a little bit high this way to feel comfortable, but to open this here. And then in the moment that you are going to press here, you are going to take a nice deep breath by your mouth open, like that. Okay, so let's do it. So we shake it really well. Again, we are emptying the lungs. That's only another way to do it, but really I recommend the aero chamber better, because with this, you see, you don't need to have this coordination. And sometimes the problem is having this way, the medication can go in the lower or higher or in the eyes too. So this is the best ways to use the aero chamber.
Epilepsy is a disorder of the nervous system which may result in recurring seizures. It occurs in 1 out of 100 people and most commonly develops during childhood. The 3 most commonly occurring seizure types are tonic-clonic, complex partial, and absent seizures. The following segments were taken from a video entitled All About Epilepsy, which was provided through the courtesy of Epilepsy Ontario. The tonic-clonic seizure, also known as the grand mal seizure, is a generalized seizure in which the whole brain is involved. The seizure starts with the person crying out, losing consciousness, and falling down. You should ease the casualty to the floor and loosen tight clothing, especially around the neck. The person then develops a generalized stiffening of the body. Respiration may briefly cease, which will cause the person to turn dusky blue in color. Then the person experiences convulsions, alternate periods of spasms and relaxation of the muscles. This will affect the face, arms, legs, and trunk. Stay calm. There is no need to restrain the person. The seizure cannot be stopped. Remove any hazards from around the person. If the person is in water, support their head above the water. Never put anything in the person's mouth. They are in no danger of swallowing the tongue. The person may make grunting sounds, salivate heavily, and become incontinent. They may bite the tongue and bleed from the mouth. After 1 to 3 minutes, the seizure will subside and they will regain consciousness. The person may be confused, have difficulty speaking, complain of a headache, and wish to sleep. Reassure them and let them rest. In rare cases, someone may experience status epilepticus. This is a series of seizures without gaining consciousness. If you see someone experiencing a seizure for more than 5 minutes or who goes into a second seizure within a few minutes of the first, call an ambulance immediately. Although this case is extremely rare, it is life-threatening and should be treated as a medical emergency. The second common type of seizure is the complex partial, formerly known as the temporal lobe. It is one in which only part of the brain is involved, but consciousness is impaired. Some people will initially experience a vague sensation or warning that a seizure is about to occur. This may consist of a feeling of anxiety, nausea, or strange taste, odor, or sound. This is actually the very beginning of the seizure, and the person is still conscious of what is occurring. The seizure may proceed from this point, and the person may appear confused. They may engage in random purposeless movements over which he or she has no control. These may include wandering, mumbling, lip smacking, pulling at clothes, or repetitive body movements. This type of seizure is sometimes mistaken for drunkenness or a drug overdose. It is important to keep the person safe. Do not restrain them, but gently guide them away from hazards. It will typically last 2 to 4 minutes, and the person will be unable to recall the seizure events afterwards. Reassure the person and tell them what happened. A third common type of seizure is the absent seizure, which used to be known as a petit mal seizure. This type of seizure occurs almost exclusively in children and will usually disappear by the time the child reaches adolescence. An absent seizure consists of a 5 to 15-second lapse in consciousness, during which the child may blink rapidly, roll the eyes, or smack the lips. This can sometimes be misinterpreted as daydreaming. Some children can experience hundreds of these small seizures in a single day. There is no need for any type of active first aid. After a seizure, the child may be anxious. Reassurance is important. The child's parents should be made aware of the timing and the number of seizures so that they can report this to the child's physician. Anaphylaxis is a severe allergic response. A quick reaction to symptoms can mean the difference between life and death for someone at risk. The following segment is taken from a video entitled Taking Control, Anaphylaxis and You, produced by MediaWorks, and shows the importance and proper use of an auto-injector in responding to anaphylaxis.
It's important to realize that in treating anaphylaxis, adrenaline or epinephrine, they're the same thing, is the single most important drug to use.
So what epinephrine does is it reverses the allergic reaction.
Adrenaline is a hormone that circulates naturally in the body. It's the fright or flight hormone.
The nice thing about it, it works almost immediately. And so that if you're having a severe reaction, it is really the drug of choice.
Epinephrine can be administered by syringe or auto-injector. Auto-injectors are most popular because they are portable and easy to use. Here is a demonstration of an EpiPen auto-injector. There are 3 steps. First, pull off gray safety cap. Second, jab black tip into outer thigh until the unit activates. Third, hold EpiPen in place several seconds, then discard unit. When using an auto-injector, be sure to listen for a click to ensure the unit has activated. The unit must be pressed and held for a full dose to be delivered.
Err on the side of giving the medication. Even if you give it unnecessarily, even if this is a mild reaction, there's very little price to be paid for a dose of adrenaline in most people, especially children.
Now, adrenaline works only for a short period of time. They'll have a temporary benefit. It'll wear off after perhaps 15 to 20 minutes. So it's important that they go to the hospital for more definitive therapy in the event the symptoms come back.